I'm Dr. Hope Ferdosian, and I'm an internal medicine, preventive medicine, and public health physician. Over 2 decades, I've worked across 6 continents on global public health issues that include the prevention and treatment of infectious diseases of zoonotic origin. I've seen firsthand how diseases born of the exploitation and maltreatment of animals can harm individual patients, their families, and communities around the world. The physical and mental stress of unnatural living conditions in fur farms and other factors that simply cannot be mitigated present a particular risk for the emergence and spread of infectious diseases. That risk was illustrated in real time during the COVID pandemic. Despite rigorous mitigation measures, transmission of the virus within and across species was rampant. Fur farms in particular create virtual petri dishes for known and unknown pathogens. To prevent future outbreaks and pandemics, and for the sake of public health, we must end fur farming and trade now. You can lead the way. Thank you.
I'm Jakob Zinstag, a veterinary epidemiologist at the University of Basel. We are testing the One Health paradigm of an incremental benefit resulting from a closer cooperation between human and animal health and other sectors. Looking at human and animal health in the same time draws our attention on the animal ethics and welfare in relation to disease control. In the aftermath of the avian influenza pandemic in 2005, we stated that research for vaccines should urgently be complemented by modifications to smallholder livestock systems and live animal markets to prevent or reduce interactions between wildlife and livestock which might be reservoirs for future pandemic. During the COVID-19 pandemic, the virus was transmitted to farmed mink in Europe, leading to massive outbreaks and spillbacks of the virus to humans. We urgently need to improve animal health and welfare to reduce the risk for the next pandemic at the levels of animal rearing, transportation and marketing. To achieve worldwide traction, we should engage for global action such as the United Nations Convention on Animal Health and Protection. For the sake of public health, we must engage to hold fur animals under humane conditions or end the fur farming and trade at all.
Hello, my name is Anne Linder. I currently serve as the Associate Director of Policy and Research at Harvard Law School's Animal Law and Policy program. For the last 4.5 years, I've led our research initiative examining the intersection between zoonotic disease and animal industries. While we examined more than 35 different forms of animal industries, fur farming stood out as an area where the danger to public health is particularly high and where regulation and risk mitigation are unfortunately low. On fur farms, you have high and huge densities of animals often held together in poor conditions with little to no veterinary oversight. In addition, you have high-intensity human-animal interactions taking place, such as manual slaughter and skinning of animals that can allow for viral spillover. Wildlife farming not only allows for emerging pathogens from wildlife to reach humans, it can also take existing pathogens from people, change them, and make them more dangerous. COVID-19 spread from mink producers to farmed mink where it mutated and spilled back over to humans. This process, or portions of it, happened over and over again in at least 12 different countries where captive mink became infected, threatening to create new and potentially more dangerous forms of the COVID-19 virus. Our report concludes that the problem is not simply that the ways in which humans employ animals drive zoonotic risk, but that too often policymakers are acting indifferently or recklessly with respect to those risks. There might be many risks worth taking, but fur farming appears to be an instance where this cost-benefit tilts grossly out of balance. Thank you.
I'm Natalia Cediel. I am Associate Professor of Universidad de La Salle in Colombia, South America. I am member of the One Health High-Level Expert Panel, and I'm co-founder of the Community of Practice of One Health and Biodiversity. Fur farming has conditions that can pose significant health risk, particularly in terms of disease emergence and spillover. So conditions such as high density, housing, poor sanitation, and living in close contact with animals and humans can create an ideal environment for the spread of zoonotic diseases. These conditions mirror some of those seen in other animal farming systems, which has been linked to emergence of diseases like avian influenza, swine flu, and COVID-19. Fur farms often house species like minks, foxes, and raccoon dogs, which are known to be susceptible to viruses such as SARS-CoV-2, as evidenced by outbreaks on mink farms and in Europe and North America. By reducing the reliance on fur farming, we can mitigate the risk associated to disease emergence, protect both animal and human health, promote animal welfare, and move towards a more ethical, resilient global systems. It's imperative that governments take decisive steps to phase out this high-risk practice, implementing policies that prioritize public health, environmental safety, and animal welfare, thereby reducing the risk of disease emergence and potential outbreaks at national level and at a global level. Thank you.